And joining us now, Dr. Paul Sundberg with the Swine Health Information Center. Paul, it is great to have you back on the show. Merry Christmas to you and yours. How are you?
Thanks, Jesse. It's always good to be with you.
I appreciate the time, Paul. We got some exciting things to talk about and catch up on. I think the biggest thing to start with is the Swine Health Information Center receiving pork checkoff funding for the program extension and extending this to 2027. Talk about this funding, the renewed funding from the National Pork Board, and how this all works, because this is very exciting stuff.
Yeah, it is very exciting. I'm really excited about the opportunity to go forward now. The Swine Health Information Center started in 2015, and it was an experiment. It was an experiment by the National Pork Board. That board of directors said, we've got PRRS that came at us in the 80s, circovirus came at us in the 90s. Now we've got PED that's coming at us in 2000s. We're doing the same thing over and over again and expecting something different. So let's do the Swine Health Information Center, and let's start looking for things that come at us, that are likely to come at us, and start being better prepared should they get here. And so that was the effort. And part of the contract in 2015 said that if there's a return on investment, there may be an opportunity for further funding. Through these last 5.5, almost 6 years, the return on investment we've made a case for that. And the National Pork Board looked at that. The pork producers across the country looked at that and said, we can't let this go. You're focusing on emerging diseases. It is the focus the industry has on emerging diseases, and we can't let that go. So we're real happy they've spent another $15 million on continuing this the next 6 years. And so I'm looking forward to the future.
Well, as you talked about, I mean, looking at emerging diseases, and there's been no shortage of things we've been watching and worried about here throughout the last 6 years that the Swine Health Information Center has been in place. And I know we'll talk about that in a little bit, but there's a lot of things that you guys put together. I know one of those as well is the plan of work. And you are currently working on that for getting ready for 2022, et cetera. So catch us up on what maybe give us a refresher on what the plan of work is and where you're at with it currently.
Sure. So if you're going to focus on emerging diseases, you've got to also be nimble enough to reply and respond to emerging diseases as they happen. And back in 2015 when we started, there was no indication that African swine fever was going to be the major emerging disease globally. And there are going to be things that are going to come at us in the future that we don't yet know about. And so that's part of what we're trying to do. There are 3 things that are going on the plan of work, and that is consistent with our mission. And our mission is to monitor for emerging diseases, to do targeted research to either hopefully prevent, or at the very least be better able to respond and control emerging diseases, and then to use the data and the information that's in our industry right now and do some data mining and some looking at the information that we have and see what we can get out of that, all of that individual information, to collect it in one spot and see if we can mine it to look for trends and look for ways that we can do better. So the idea behind the plan of work is really a 12-month plan, trying to be nimble enough that we don't look out 3 to 5 years from now, because again, we can't predict what's going to happen. So I want to look 12 months in the future and say, what are the big things that we need to do to address emerging diseases in the next 12 months? And that may include response, but it probably includes things like looking at endemic diseases we have now and trying to be able to better control those and use those as a template for something that may be emerging in the future. For example, one of the things that is a common input into all of the people I've talked to about 2022 is our finishing floors, and where we have newly weaned animals that are fed up to market. Those spots are an opportunity for emerging diseases to get a foothold and then to spread back into breeding herds and give us more problems with wean pigs or suckling pigs. And it's one of the common themes about 2022 has been focusing on finishing floor biosecurity, which means both containing an outbreak if it happens on a finishing floor, and that's called biocontainment, or bioexclusion. The question is, how do we keep pathogens away from those finishing floors so they don't get sick? So I think in 2022, I'm looking forward to that being a big piece of what we're going to try to address as far as finishing floor biosecurity, biocontainment, bioexclusion, and help improve the health of the U.S. swine herd.
Well, Paul, you mentioned biosecurity, you mentioned ASF. I know just a couple of months ago, Schick worked with Epic's Analytics to release the biosecurity risk assessment. And I believe we've talked about that before as well. You can mention that a little bit as well. And then also get us up to speed on ASF. What's some of the latest here as we wrap up 2021 with ASF globally?
Yeah, so the risk assessment was all about taking a third-party look, an outside eye at the ways that ASF may be able to get into the U.S. Those of us that are in the industry and working in this think we have answers, or think we've identified the windows, but the issue there was maybe we're too close, and we're seeing the individual trees, and we're not seeing the forest, and we need somebody to look at the forest, take a bigger picture look, and help us see trees that we aren't seeing right now. And so we asked Epic's Analytics to do this outside look. They're an internationally recognized risk assessment group, and their report came back and said, guys, we think that you've got the major pathways. You've already identified the major pathways. There are some issues that you got to pay attention to with closing some of those windows. Continue to close some and work on closing those, but you've probably got the major pathways. So that was a good thing. That was well received. That okay, we probably aren't missing something. When ASF hit the Dominican Republic and Haiti this last year in 2021, our question back to those folks was, "Whoa, wait a minute! What about this? This is ASF in the Western Hemisphere now. We haven't had that for 40 years. Did we miss something there?" And they said, "No, your pathways are still the same. Whether ASF is in the Dominican Republic or whether it's in China, the pathways of entry into the U.S. are still the same. So you still have to work on those things." ASF update around the world. China is the big question mark. The pork market in China and ASF effects on that. Those are all big question marks. There's no doubt the ASF is still alive and well in China and moving very well. Vietnam is really about the same thing. They're having continued ASF outbreaks in Vietnam, even in spite of their efforts for one, biosecurity. Another, they're working on an ASF vaccine that is in field trials there. We don't have any reports on the effectiveness, the safety or effectiveness of that yet, but it is a USDA model vaccine. So we expect that it will be safe and effective. We expect that it will be helping, but I don't have any reports on that yet. One of the concerning things is that we've gotten a report from China about a different strain or a different serotype of ASF that's entered into China. It's a less pathogenic one. It was one that has been in Africa for a long time. Somehow it got into China. And the issue there is that may give the ability for this type of African swine fever virus, this particular serotype, to spread more under the radar, if you will, and cause broader infections before it's even detected. We've gone to USDA and we've asked them about our ability to protect the U.S. from that. And their response has been all of our testing, all of our procedures within diagnostic labs should be able to pick up that new strain as well. So that means that we're right back to closing all those pathway windows and making sure we're doing everything we can do to keep these viruses out of the country.
Paul, great stuff as always. Finally, as well, I know we had some issues with PRRS in the Midwest here this last year. Any other comments about any other foreign animal diseases that we're seeing in our swine herd here throughout the U.S. or anything else we're watching closely? I don't, as far as PRRS or anything else for that matter.
Yeah, so the PRRS, especially PRRS 144 line 1C, that's a specific strain of PRRS that's been causing a lot of trouble up in the upper Midwest. But we've got plenty of strains of PRRS. We've still got 184, we've still got 114. I mean, you can get into the weeds of all the numbers. We've got plenty of strains of PRRS that are still alive and active out there. And the deal there is, it's all about biosecurity. It's all about, again, looking at that finishing floor and the opportunity for the finishing floor to break with PRRS, and that means it's going to seed down the breeding herds. And so that kind of closes the loop. We're paying attention to PRRS as that example of a disease that may affect the finishing floor that may end up in the breeding herd. As far as other emerging diseases that we you might call them foreign, but there are emerging diseases that we're keeping an eye on. And that list, Jesse, I'll tell you, that list just about as long as your arm. And you're going to hear about things that you've not heard about before. Sapalovirus, sapovirus, morbillivirus, cubovirus. All of those things are things that the center is watching and monitoring for. And we've got diagnostics for, we've got help. And again, it's about that monitoring. It's about targeted investment, and it's about analysis of data to make sure we've got a handle on things like that before they happen.
Well, Paul, Swine Health Information Center, you and the team there doing great things to help keep on top of these diseases and keep our swine herd healthy here in the United States. I appreciate the time. Thanks for joining us once again. I know we will talk with you again real soon, I'm sure. Thank you so much.
I look forward to it, Jesse. Merry Christmas.